red, it's raw, and it gets inflamed.
It's invisible on tests.
You can't give it to your worst enemy.
Pain you can't describe.
And you can't pluck it away from your best friend.
Even surgery may be a big mistake.
We don't know what causes it.
What's worse?
Nice and slow.
Can't stop it.
It's kind of like a freight train. You jump on a freight train, you may slow it down a little bit, but it's still going to run its course.
It can run as long as 2 years, a bumpy and painful ride.
There's no explained, action or injury that would have caused it.
Still, Michelle Wisniewski has never felt anything like it.
Always the top of it. I can feel the burning.
All day, all night, every day.
Losing the use of your arm.
And it gets even worse.
Is that okay?
What happens if you raise it more?
It won't go. It literally is locked.
It stops like a door that just shuts.
What if somebody helps?
Now, if someone did, I would scream in pain. I'd probably hit the ceiling.
Finally, after months of suffering and struggling to complete the very simplest of tasks, Michelle, who does not run to the doctor for every little thing, broke down and sought help.
I went in thinking I had a torn rotator cuff.
And would surely need some kind of surgery. But her x-ray, MRI, you name it, all tests look fine.
I personally think it's probably the most commonly misdiagnosed shoulder condition. It's a lot better than I would have thought. Let your arms relax.
Orthopedic surgeon David Rubenstein has treated almost every tricky shoulder injury you can imagine on professional sports courts, fields, and ice. But he says frozen shoulder is a baffling and frustrating slam dunk.
Frozen shoulder is a weird condition.
And for some reason, he says, the thin, soft tissue connecting the ball in the socket flares up, thickens up, then locks up.
I had never heard of it.
But she is among a growing number of fairly younger women coming in for treatment these days. Dr. Rubenstein says the average age of women treated for frozen shoulder syndrome is early to mid-50s, and they are double the number of men who tend to be diabetic.
Spin.
He's seeing women in their 30s.
Push in.
Michelle is early 40s.
Good. She's still in the freezing phase.
Stage 1, he says, of 3, freezing, inflamed, and pained. Frozen, stiff but less painful, then thawing, gradual healing, and return of motion.
So just walking up there with your fingers?
Michelle is in rehab therapy right now, hoping that may get her through the process faster.
It's actually a very relieving stretch.
What about surgery?
It's probably too early to do any surgery, but it's unnecessary. That's probably the most important feature.
Unnecessary for Michelle, he says, and most other frozen shoulder patients. But surgery was just what Dr. Rubenstein ended up ordering for Dr. David Stricklan,
Next on a rotation.
an internist with Mainline Healthcare. He's in his 50s, diabetic, and got no relief after months of rehab.
Maybe 15 degrees there, maybe a little bit more.
I didn't get any better. So I was pretty frustrated.
Side.
6 months later,
Straight up.
and barely a scar.
This was the quicker way to get better, and now the rest is on me to really continue to rehab it at home.